Thank you for your interest in the Blue Ridge Humane Society foster care program. The goal of this program is to place dogs and cats into temporary homes until they are ready for permanent homes or to give an animal a break from the shelter environment. Blue Ridge Humane Society is a nonprofit 501c3 animal welfare organization. We began operating our pet adoption center in Hendersonville, North Carolina in 1980. We partner with Henderson County Animal Services to find homes for hundreds of adoptable dogs and cats each year by assessing and pulling adoptable dogs and cats that arrive at our county facility. We also pull a large number of underage kittens which rely on foster homes to care for them until they are old enough to be adopted. In 2019 alone, we placed 452 animals into foster care. Fostering is an integral part of our work, and we would not be able to help as many animals as we do without the help of the dedicated foster volunteers who act as a loving bridge to a forever home. We believe that almost anyone can be a successful foster and strive to match animals to the right fosters based on their lifestyle, availability, and experience level. In general, before you get started, make sure you can provide the time, space, and attention needed to successfully care for animals in your home. All fosters must have reliable transportation and live within a 30-mile radius of our adoption center. You must be able to communicate with our foster team by phone and email and have regular access to the internet. Fostering with Blue Ridge Humane Society does not require purchasing anything to get started. All supplies such as a carrier, crate, food, litter, bedding, toys, and bottle feeding supplies will be provided as needed. You are welcome to provide any of these supplies on your own, but please understand we will not be able to reimburse you for purchases you make. At Blue Ridge Humane Society, we have several opportunities to foster dogs, kittens, nursing dogs and cats, and occasionally puppies. Our neonatal foster program is designed to help kittens and occasionally puppies under 8 weeks old that are not yet ready for adoption. The type of care required to foster depends on the age of animals you take home. Bottle babies are between 0 and 4 weeks old and need to be bottle fed every 2 to 4 hours around the clock for the first several weeks of their life. They must be kept warm with an external heat source like a snuggle safe and stimulated to go to the bathroom after each feeding as they are not yet capable to do it on their own. Bottle babies work well with foster homes that have a flexible schedule or that live with multiple people who can take turns feeding throughout the day and night. Bottle babies need to be in foster care for up to 2 months. Weaning babies are between 3 and 5 weeks old and need to be fed every 4 to 6 hours. Babies in the process of weaning are transitioning from bottle feeding to eating a slurry of formula and canned food. The weaning process can take anywhere from several days to a couple weeks, and they need one-on-one attention at each feeding. Weaning babies need to be in foster care for up to 5 weeks. Weaned kittens and puppies are between 5 and 8 weeks old. While they are eating on their own, they still need fresh canned food put down for them a couple times a day, access to dry food and fresh water at all times, as well as daily socializing and playtime. Weaned animals need a foster for about 2 to 3 weeks, although it may take longer if they are small. Neonatal kittens and puppies will need to be weighed daily during their time in foster. We also often have nursing moms and kittens and occasionally mom dogs and puppies who need time in foster until the babies are big enough for spay and neuter surgery. Moms will need to be fed several times a day, but will nurse and care for their babies. Moms and babies are a great way to get started with fostering as mom does most of the work. Once returned, mom will also be spayed and put up for adoption. When fostering neonatal animals, you will typically be asked to foster at least 2 kittens or puppies at a time, although there are occasional opportunities to foster 1 at a time. Moms and babies are fostered together all in one group, regardless of how many babies she has. It is highly recommended to keep neonatal animals isolated from resident pets, as they are at a higher risk of catching or carrying shelter-related illnesses. A warm, confined space such as a spare bathroom or mesh playpen works well as they are easy to kitten or puppy-proof, clean, and sanitize. Bottle babies are housed in an even smaller space like a carrier or large plastic tote set up with blankets and a heat source. We strongly recommend confirming your pet's current vaccine status with your veterinarian before getting started with fostering. Blue Ridge Humane Society is unable to provide vet care for personal pets in the event that they become sick. However, as long as you are following all necessary precautions, transfer of shelter-related illness is very unlikely. Please note that the vast majority of our neonatal program is geared towards underage kittens, as they are the most at-risk group in need of rescue in animal shelters. If you are interested in primarily fostering puppies, there may be a wait before we have a foster opportunity available, as we don't see as many puppies come through our program. Our adult dog foster program focuses on dogs that are taking a little bit longer to get adopted. This is an opportunity for a dog to have a break from the shelter environment, as well as gather information about how the dog behaves in a home environment so we can better showcase them for adoption. There is flexibility in the foster period to foster adult dogs and may last anywhere from a long weekend to several weeks depending on your availability and the needs of that particular dog. During the foster period, your job is to gather info on the dog's quirks, likes, and dislikes, and give the dog a quiet spot to relax after a stressful shelter stay. Fostering adult dogs works best in homes that have the ability to separate a foster from resident pets. A period of 1 to 2 weeks of quiet time, known as a decompression period, will help them acclimate to their new surroundings. Please note that many of the dogs in our care do not come to us with specific information on their histories, and it can be difficult to predict or guarantee behavior in a home environment. Depending on the dog and the length of the foster period, our behavior team may offer advice on how to properly introduce your foster to resident animals once they have settled in. The dogs that are most in need of foster care are usually medium to large in size, as small dogs don't usually wait too long to be adopted. Occasionally, we have opportunities to foster small dogs if they need socializing or have medical needs. Foster dogs will need to either be walked on a leash or be supervised in a fenced-in area when outside to potty or play. Foster dogs should not be left outside unattended. You will be able to consult with our behavior team for training tips and guidance, and together we will discover what support an adopter will need to succeed with that animal in their home long term. The information you gather during the foster period, as well as pictures or video of your foster dog, will be used to help us highlight the dog for adoption and provide immediate feedback to give potential adopters on how the dog is in a home. We often find that dogs that have had the opportunity to be in a foster home can get adopted quickly into loving homes because of this information. We also have opportunities for medical fosters for our animals. There are many reasons why an animal may need a medical foster, like time to heal from broken bones or to recover from an illness. These animals may need foster care from anywhere from a couple weeks to several months, and all medications and vet care will be provided. If you are interested in being a medical foster, you must be willing to provide whatever in-home treatment is prescribed by our medical team, which may include daily medication, crate rest, or scheduling regular vet checkups. Fosters are contacted on an as-needed basis when there are animals in need of foster care. Vulnerable neonates often require same-day pickup, but we are sometimes able to provide more advance notice for other types of fosters. Pickups happen at our adoption center, usually in the afternoon. When you pick up your foster, you will be sent with all of your supplies, the animal's medical history, and any written instructions. Foster animals will often need routine treatments like booster vaccines at our adoption center about every 2 weeks. These appointments typically only take 5 to 15 minutes and must be scheduled in advance with our foster team. While all animals in our care receive age-appropriate vaccines and a brief medical exam when they arrive at our adoption center, there is still a chance that one or more of your fosters may catch a shelter-related illness or have been exposed prior to entering the shelter. If you notice any signs of illness, such as sneezing, coughing, vomiting, diarrhea, loss of appetite or energy, let us know immediately. We will determine the proper course of action and approve a vet visit if needed. Please do not take your foster to the veterinarian without prior approval. If you are unsure if your foster animal needs medical attention, email the foster team at foster@blueridgehumane.org and medical@blueridgehumane.org. If your foster is in need of emergency after-hours care, we also operate an emergency hotline, which you can call 24/7. As this is a shared line, you must leave a voicemail, and a staff member will return your call within 15 minutes, day or night. Once your foster time is ended, you will need to return your foster to our adoption center. Kittens typically return when they are about 2 months old or when they reach 2.2 pounds. Puppies are returned when they are 8 weeks old. They will be spayed or neutered at the ASPCA Spay Neuter Alliance in Asheville and returned to our adoption center to find their new homes. For adult animals that are already fixed, we use the information you have given us to create a bio that will highlight the animal for adoption. If while you're fostering you find someone interested in adopting your foster animal, please contact the foster department before you return the animal to our adoption center. A potential adopter will need to fill out an adoption survey, pay an adoption fee, and go through adoption counseling before they can take that animal home. You may not transfer the care of your foster animal to anyone else without written approval from Blue Ridge Humane Society. The space where your fosters were housed will need to be thoroughly cleaned and sanitized after the foster period and before bringing any new fosters in. Some frequently asked questions are, what is the minimum age required to be a foster? Really, any age can foster. Volunteers under 18 years of age must have a parent or legal guardian as the legal foster, and all children should be supervised when interacting with foster animals. What do I do if I am no longer able to continue fostering an animal? If while you are fostering you have a personal emergency or are suddenly unable to commit to the duration of your foster activity, please contact the foster team to arrange to return your animal to our adoption center. If possible, please allow 48 hours notice, as we are often able to send these animals into another foster home if given enough advance notice. Can I foster for other organizations? We do not have any restrictions with fosters working with other organizations. With that said, we ask that you observe best practices such as fostering for only one organization at a time and thoroughly cleaning and sanitizing between fosters so as to reduce the transmission of disease across organizations. What types of resources do you offer your fosters? Our foster medical and behavior staff are always available to assist fosters with advice and to answer any questions they may have along the way. We provide printed literature as well as educational opportunities such as bottle feeding workshops throughout the year. We also have a Facebook group for fosters where they can ask questions and offer or request advice and support. Thank you for watching this video and for your interest in the Blue Ridge Humane Society foster care program. Your dedication to helping animals in need is truly appreciated. Once you have watched this video, completed a brief quiz and the foster care questionnaire, you will be contacted within 24 to 48 hours by our foster team to answer any additional questions you may have. If you have any difficulty completing these next steps or have any questions, please contact our foster team at foster@blueridgehumane.org. We look forward to working with you and thank you again for your interest in fostering with the Blue Ridge Humane Society.